pause go back to our phones now. I can move this forward if I need to, all right? So now I can touch anything in here as long as I'm not touching anything that's contaminated. Make sense? So don't be afraid to go in your kit and now touch things. Don't do this. Another reason to get your bed into a position that is a good working position. Now I have the fenestrated drape. I can open that. And then I'm just going to simply take it. Do I have to respect a 1-inch border here right now?
Mm-hmm.
No, because everything I'm touching with my gloves is sterile. Okay, so I'm just going to take this and I'm simply going to place that over the patient. These are the areas you end up contaminating, right? Touching the blanket. So be careful, just take it and drop it. Now I have this nice little sterile field. You guys can remove stuff that you don't need. I don't care, it's up to you. But if you get rid of it, just throw it away if you don't want it. This is your cleansing solution, which you are not going to open, but you're gonna mimic that. I'm actually gonna turn this box this way because this is gonna create a little more space for me. Did I contaminate anything? No, because I've got sterile to sterile. And I'm gonna keep going back to that, and I know it's gonna sound like I'm repeating myself a lot, but it's a good reminder. So I have these little forceps in here that I can loosen. I have cotton balls, and I have lubricant, and I have my syringe. So I would tear this. I'm gonna get as much solution on those cotton balls as I can, and this is what I'm talking about when you're done with something and dropping it high. You guys that are very neat wanna take it down and you wanna tuck it down into that little trash, right? You're gonna drop it. If it lands somewhere where it's not supposed to be, leave it, okay? This is how you maintain a sterile field. All right, so you're gonna take your, and I don't want that either. So you're gonna take your lubricant. Now these are the steps where you can kind of adjust a little bit. If you don't wanna open this lubricant right now because you're gonna get lubricant all over your fingers and then everything else you touch is gonna be messy, that's fine, doesn't matter. But you're gonna take this tray and you are gonna move it toward closer to you, all right? I don't think I got his legs far enough apart, but that's okay. And my hands are nice and high, my elbows are up. There's a little cap on here that you're gonna wanna take off. You don't need that. You can go in here and attach it now if you want to or not. Doesn't matter to me. Again, this is more about showing you the pieces. So in here you have your urinary, your bag. You have your catheter that's attached, the one that Jacob was talking about. And I think I'm gonna actually point it this way. All right, so I have everything I need. Good to go. I'm gonna open my lubricant at this point, try not to get it all over my fingers. Now I know with the NG tube we did not use lubricant on the mannequins because we can't clean that part of the mannequin. With this we can. We can remove the genitalia and clean those so we can use the lubricant. I'm gonna squirt that in there. Drop that high. Oh, didn't go in the bag. Terrible, terrible. Okay. So, I think I've got everything set up, everything I need to do. I'm gonna leave this in here. This has a cover on it that needs to come off. And I'm going to slide this off carefully with this hand, and I'm going to throw it away over here. But let me show you something that students tend to do, is they will take this off with a different hand and start doing a lot of crossing over that sterile field. So do it with your right hand or left hand, whichever one you're, and then make that go away, okay? We're still sterile. I'm gonna put my lubricant at least 2 inches. I think that was but I think it's as much as you can. I certainly would appreciate it. Lots of lubricant on there. And then there's a little notch here that you can actually tuck that in if you want. And then it's not flopping all over the place. We good to go so far?
Mm-hmm.
Okay, lots of steps. So now I'm gonna put my syringe on the port. And that's on nice and tight. I don't need to do anything else. So I think I'm ready to clean my patient. Did I break my sterile field yet? Okay. Because it could happen. Because you know me. All right, so now I'm gonna make a commitment with this hand. to grasp the genitalia, whether it's male or female, okay? So once my hand is here, this is considered contaminated. It does not move, okay? It does not move from the patient. So I'm gonna grasp here. And with a male, you wanna start here with your cotton balls. So your little tongs, you pick it up, and this would have iodine or whatever cleansing solution they had. And you're gonna start at the top, and you're gonna circle around. All right, and then you're gonna come around your field, and you're gonna drop that, and then you're gonna go back in, and we're gonna start at the top again, and then we're gonna go down a little bit farther this time. I'm gonna go around, and you can go this way too, it doesn't matter, but you don't wanna drip stuff back across that field, right? So the last time for the male, you're gonna start at the top, you're gonna go all the way around, and this time you're gonna include your glove. Once you hit that glove, we're gonna go in. I don't need this anymore, so that goes in too. So now I'm ready to put my catheter in. So I wanna make sure I let my patient know. One of the things we ask them to do is to bear down like they have to urinate. And I wanna let them know that I'm introducing this catheter now, okay? You wanna have about 3 inches that are lubed, 2 to 3 inches. Don't hold it so far back that you're gonna definitely contaminate, right? So 2 to 3 inches here, you have good control of the catheter. I'm gonna have the patient bear down like they have to pee, and then I'm gonna start introducing the catheter. So I'm gonna feed it in. I'm gonna keep talking to my patient. Now what I'm not gonna do though is I'm not gonna tap these fingers on the edge of the genitalia, male or female, right? We're going in, I'm being careful. Okay, so I see urine now. I see urine flow. So with the male, I'm gonna go where?
The bifurcation.
To the bifurcation. So I'm gonna slide it all the way in, making sure my patient's doing okay. Have not moved my hand from the genitalia. All the way in, feeding it in, feeding it in. Please don't let go of it at this point. Okay, you can tell your patient to relax. You're going to reach forward with this hand now, and you're going to pinch the catheter so you stabilize it, and now you're gonna push the fluid into the balloon, all right? And I'm gonna say to my patient, let me know if you're feeling any additional discomfort at this point. I'm gonna watch their face. So if for some reason it didn't go where it was supposed to go, which is pretty near impossible, right? Or if it's being inflated in the urethra, they would feel some additional pain. So I wanna make sure I'm checking with them. You doing okay? Good. Almost done. Now you're gonna hold your thumb on top of the syringe. Because if you don't, if you let it go, you'll get a backflow, okay, of the fluid. So you're gonna push it all the way in. Now I can release, come up here and disconnect two-handed because I wanna keep the pressure on that syringe. And that's when students go, oh, done. This will just sort of naturally flow down. I was taught that you do a little gentle tug on here. We don't do that anymore. I got schooled on that one day. So then the next step is to do what we talked about, which is you're gonna state that you would secure it to the patient's leg. It's going to be put on an immovable part of the bed below the level of the bladder with no dependent loops. Not kinks, but no dependent loops. Dependent loops would be things like this, where you have urine that would collect down in there, okay? Then you clean up your patient and you document.